Hello and welcome to this special show on Rajya Sabha television. I am Vishal Dahiya and here we bring you all the details of India's fight against COVID-19. Now there are several aspects to this particular battle which we are fighting against coronavirus. Drugs, vaccines, development of other scientific tools to try and tackle this particular disease, and we brought you all the details one by one in our show. Today we're going to talk about a different aspect with respect to COVID-19, and that is the stigma and discrimination which some of the COVID-19 patients face during their battle with this particular virus. So what exactly are these forms of discrimination or stigma, and how it can be dealt with, and what as responsible citizens we should go ahead and do? For more on this, we're joined by a distinguished panel of guests. Let me first introduce the guests to you, beginning with Ms. Padmaja Singh. She is Joint Secretary with the Ministry of Health and Family Welfare. We also have with us Mr. Anant Bhagwati. He is the director with Dasra, the NGO, who is involved in spreading this particular message that how this discrimination and stigma can be tackled. We also have with us Dr. Rajib Dasgupta, the professor from Center for Social Medicine and Community Health in Jawaharlal Nehru University. Welcome to Rajya Sabha television. And let me first start with you only, Professor Dasgupta. Let's start by understanding what kind of stigma or discrimination is associated with COVID-19. It's just another virus.
Well, at one level, it's another virus. At another level, it's a 1 in 100 years pandemic. It's a new disease and therefore carries with it both the biology of the unknown and the fear of the unknown. And therefore, as knowledge unfolds, we have had tremendous progress in understanding its biology, its virology, its clinical features. It has also affected the society as well as individuals who are suffering from the disease or who are suspected from the disease or who are in the business of care, which is particularly healthcare workers and other essential service providers. So if we look at the different groups, there are those who are in the quarantine, which carries with it own challenges of stigma and psychosocial stress. There are those who are patients who are admitted in isolation centers or hospitals or even intensive care units. There are those families who unfortunately have had to encounter death. And there is a vast army of workers, healthcare workers, as well as other essential services workers. What has happened, broadly speaking, is all these different groups have had different experiences, diverse set of anxieties, and a very diverse experience of disenfranchisement, which has been linked to ethnic groups, which has been linked to religious groups, and in some cases often can be on the basis of caste and tribal identities. That, to introduce this, is the broad landscape. We can go on to the more specific features as we discussed.
Okay, that's broadly identifying what exactly is the social stigma or discrimination faced by the COVID-19 patients. Mr. Bhagwati, your views on that as to how do we, define this stigma or discrimination attached to COVID-19 patients?
Sure. Thank you so much. And it's a pleasure to be on the show. I resonate a lot with what Rajiv just said. I think what we are seeing is COVID-19, while it is once in 100 years event, but many of the discriminations or many of the problems were actually pre-COVID, and COVID has brought them to the surface. And just to take that point, I think if we look at, for example, adolescent girls, who is a population group which is absolutely critical to India's development, but also who have many challenges. I think, the challenges have got magnified, whether it's around how does one move towards employability, how does one actually stay in school, or even how does one stay connected to the community. So these challenges are always there. I think in the time of COVID, it has been very, very hard to maintain the connectedness, and that's why the vulnerable groups are becoming really, really stressed. So that is one part of it, and we can talk about it more. I think the very unexpected but other part of it is COVID has led to a huge amount of focus and funds flow towards relief, and it's absolutely important. It's absolutely critical to have food on the table and direct cash transfers. But lives need more than food and direct cash transfers. It needs education, it needs employability, it needs hope. So I think what's happened to the sector as a whole is it has moved completely into the zone of relief and short term actions. So, in a way, another group which is getting into a lot of stress are NGOs who have got a certain set of agenda and mission, which is quite valuable. And just to take an example, pregnant mothers who are actually going to deliver are a very, very critical group. And this group has to get a lot of support. COVID has made it very hard for that group to get medical attention because of the stress on the medical facilities. So there are these unintended consequences also going on in terms of what COVID has created in the sector. Thank you.
Okay, and an important aspect here is also, Mr. Bhagwati, that it's an infectious disease. So thereby, those connections which you were talking about within the community, within the society, and between neighbors as well. For example, if there is a COVID positive patient, then initially there is a bit of a hesitation in interacting with that patient or giving help to that particular patient. That also is a very important aspect, isn't that?
It is, and even the terminology. I mean, the very simple term of spreading the virus. I mean, something as basic as that, sometimes used in a very unintended manner, can lead to a bit of a fear psychosis. So, being very watchful about the fact that this is something which is not intended. It happens to people, and it happens as a matter of course. And keeping people at the very center, and then working around that, it's hard, but it's absolutely critical. And especially like Rajib said, because it's unknown, people are, taking small steps forward. So I think it's very critical to do that and keep the vulnerable population at the very center.
Okay, so fear of the unknown is what drives most of this stigma and discrimination, and obviously vulnerable groups are becoming more vulnerable in this period of crisis. Let me bring in Ms. Singh here, Ms. Padmaja Singh from Ministry of Health. From the government's perspective, Ms. Padmaja, how would you look at this particular problem, and what is being done in terms of ensuring that this particular aspect is taken care of, is tackled, because most of the machinery right now is busy in fighting that battle with COVID-19 as health workers or in other aspects as well. But this also is a very, very important, significant aspect.
So to answer your question on, we need to basically decode stigma, and Professor Dasgupta and I think Mr. Bhagwati, they've already talked quite a lot about it. I basically feel that the unknown, the fact of the disease being unknown, that coupled with the fear and the stress that it's causing, the need to protect your own family, the need to protect your community, that is at the root of this entire stigma and discrimination episode. And what we need to remember is, as a community, that 80% of the people have very mild symptoms. This is a message that I'd also like to carry across through this program, that there is no need to really stress over something where people are getting cured. And the other thing is that there is that people are getting 80% of the people are getting cured, and both the stigmatized and the people who are causing the stigma, they're actually on the same side of the battle lines, because the battle is versus corona, versus COVID-19. And here we are, whether it is the people who are stigmatizing, they are doing it from the point of view of protecting themselves, and people who are being stigmatized against are people like frontline workers who are also actually engaged in protecting the community. So it's pretty clear that the enemy there is corona. It's not,
okay.
The break is not, the fissure is not in the community. Or rather, one has to see it that way, that we have to overcome this fissure.
Are there any guidelines per se from the Ministry of Health to go ahead and take care of in terms of do's and don'ts, which should be taken care of, which should be kept in mind?
So like you said, that the major focus is on fighting COVID-19. But let me tell you, on the sidelines, we are also working towards addressing stigma and discrimination issues. In fact, if you were to call up somebody, the pre-caller tune currently is addressing this issue of how not to stigmatize, because these are our frontline workers, and these pre-caller tunes are being I think played across 217 crore tele connections. So we've done that. There's a lot of dialogue on radio, on television, on community radio stations. There is, we've partnered with our development partners. There are some 10 development partners, Dasra being one of them, who are taking this message of anti-stigma and discrimination across their networks right to the last mile. There is a lot of advocacy going on with leaders of the community, whether it is chief ministers, ministers at the state levels, whether it is parliamentarians in the center, to carry a message of anti-stigma forward. There is a lot of capacity building that is going on of various networks, capacity buildings. When I say, I mean, the youth networks, the NSS, ASHAs and ANMs. Essentially, we have tried to reach across all networks, all kinds of networks in different sectors, so that they can carry this message of anti-stigma, down to the last mile. And it's important because it helps in building dialogue, and like I said, in overcoming the fissures that could possibly become huge if we don't address them right at the beginning. And more than that, there's this whole social media campaign that we're carrying on against stigma, whether it's on Facebook or Twitter. There's a whole lot of messaging. I think almost daily we are issuing some kind of messaging on stigma, and the core of the messaging is basically that you should support, you should extend appreciation of people who are impacted by COVID in any which manner, whether you're a patient, whether you're a caregiver, or whether you are a frontline worker, you're a sanitation worker. They need our support at this time, and that's basically the core. And additionally, what we are trying to say through our message is that they need to further emphasize positive stories, because the more positive stories we have there, the better it will be. There is need to stem misinformation that is spreading across the country.
Okay, definitely. So if if we gather a summary of what you have said, the idea here seems to be that reduce stress, anxiety, spread more positive messages, build bridges between the groups of society or community and between individuals as well. Dr. Dasgupta, would you agree that's the right way to go ahead to ensure that we, tackle this problem of stigma and discrimination associated with COVID-19 patients?
Yes, of course, I agree with Ms. Singh and Mr. Bhagwati. And as he very correctly put it, that many of these divisions or chasms in society are really age-old. Therefore, we both have the history of stigmatization of diseases. In fact, the word quarantine actually comes from segregation in the times of leprosy, then used more widely in plague. At the same time, we have a lot of new learning coming from the SARS epidemic, the Ebola epidemic, and therefore it's not that in the matter of tackling discrimination or stigma, we are in the dark as much as probably in some of the biological or virological assets we are, or at least we were for some time now. And therefore, the public perception both of the disease as well as of the stigma is intensely shaped by the media, as she outlined. And therefore, both social media as well as legacy media, which is television, newspapers, radio, have very significant role. And research both with SARS and Ebola actually indicate that social media really shapes the attitudes of risk perception, whereas legacy media actually shapes the perceptions of protective behavior. And therefore, it's incumbent both upon media as well as government, non-governmental partners to be actually able to leverage the advantages of these two broad streams of media, as well as we know, be able to proactively tackle some of the negative facets, particularly of social media.
Okay, and how would you define, or rather, suggest in terms of do's and don'ts for general people, for public, for responsible citizens in terms of handling this aspect, both cases, the ones which are stigmatized and the ones who indulge in this kind of process?
As Ms. Singh outlined, the ministry, both at the central level as well as the state government, right from day one, in fact, actually much before the disease actually started transmitting relatively rapidly, has had advisories, very detailed advisories, do's and don'ts, and so on, utilizing a diversity of media. However, essentially what people look forward to is both credible as well as actionable information. How much we are able to reach out in local languages and even in dialects where we actually don't have formal scripts. And that's something, the experience of Mexico is actually very instructive, where very early on they actually reached out in all the local dialects. Also the fact that both, as I was saying earlier, those in quarantine as well as those in treatment or isolation need a whole lot of psychosocial support. The role of psychiatric nurses is very crucial. Now, unfortunately, mental health services itself has been relatively weak in our country compared to some of the other health services. And therefore, these are some of the elements which need to be ramped up rapidly, because it's still not over. It's in the rising phase, as we all know. And therefore, the needs of these services are certainly going to be required by far larger numbers as we go along.
Okay. Okay, definitely. The battle is still on. Mr. Bhagwati, since your organization, NGO Dasra, is one of the 10 partners with whom the Ministry of Health and Family Affairs is working in ensuring that this message goes far and wide to avoid stigma and discrimination of COVID-19 positive people or those who are involved with this entire fight against COVID-19. So what are the processes which your NGO or your team deploys to ensure that this message reaches to the last level far and wide?
Sure. And, I think Padmaja said a very useful thing, which is, there is been a lot of proactiveness by at different levels of the government. So I think there are three things which I think now civil society has to really do, and that's some of what we are trying to catalyze. One is, I think, very clearly inspire. I think the messaging has to start shifting from the virus to the human stories. Just to give an example, there was a story where some sanitation workers who are doing an absolutely critical job, they had not had a chance to recharge their cell phones, right? And because of the direct cash transfer coming in, they were able to call their families with a very small amount of money, which may be very small for most people, but made an enormous difference in their life. It's an inspiring, very, very powerful story. So I think the first part is this has to be humanized, because only if things are humanized will people get over the fear and come into their own. I think the second part is to think holistically, because the real risk here is to move from crisis to crisis, because the moment crisis one is solved, there'll be the second crisis on our hands. So I think civil society has to start thinking of the next thing. And while the government's focused absolutely correctly on some of the most pressing concerns, how can one think one step ahead and start thinking of income repair, for example? And I think the last thing is the youth have a huge role to play. We are seeing an absolute upswell, which we haven't seen before, of people wanting to serve. So I guess the only way one can stay positive here is doing something about it. So that's the third message we are trying to pass, and starting with our own organization, which is, can we actually do something small to serve even people around us? So I think inspiring, thinking a little longer term holistically, and then doing some small thing to serve. I think these are the three messages we are starting to talk through, and not just with the citizens, but also with philanthropists, also with youth, because I think it's very critical this passes in a 360 manner.
Go ahead and spread the message of positivity as well. That is the summary out there. Ms. Singh, before we bring this show to an end, concluding comments from you in terms of a message which can go out from the government to the general public at large. Yes, there are several messages via social media, as you pointed out, and other means as well. But to our viewers who are watching this show right now, what is it that they should do, as Anant also pointed out, and Dr. Dasgupta as well, but from your side, from the government's perspective?
So there are two ways that I would look at it. One is that if we don't stem this whole stigmatization bit, it's going to harm the entire effort that we are making towards fighting COVID. For one, what this does is that it prevents people from coming out. The moment, there is this whole fear psychosis about the disease around you, people don't want to come out and go for testing. So it is actually hampering the entire testing, the entire testing bit, and that is of course going to impact the COVID operations. One aspect is that, and the other is that we do need to understand that this could happen to us as well. So there is a need to be empathetic and understanding and supportive. That alone is going to, you've got to be out there. You've got to be out there as much with the people impacted. And somehow we have all our partners with us who are carrying this message across. I think these two core messages, if they go across, we are good. And the other thing is that fight the ailment, not the ailing.
Okay, there it is. Thank you so much, Ms. Singh, Mr. Bhagwati, and Dr. Dasgupta for sharing your views with us. As our panelists have pointed out, these are indeed tough times in terms of the entire society, community, country as a whole. We are fighting this war against COVID-19 pandemic, and here we need to be a little bit patient. We need to pay heed only to credible source of information, and as our panelists pointed out, spread inspirational message, look at the human angle of the entire situation, spread positive messages, be ready to serve wherever possible, and let's not forget that it can happen to anyone. Those who are COVID positive or are involved in this fight are not the ones responsible for it. We'll come back again tomorrow with a different topic. Till then, you keep watching Rajya Sabha television, and don't forget to follow all the norms with respect to social distancing and putting a face mask while you step out of your house. Thank you.